Breaking the Taboo in Women's Health by Dominique Karetsos, Healthy Pleasure Group.
Hi everybody. Thanks for staying awake. I know we're getting to the near end and everyone wants to go celebrate. Congratulations, by the way, on a wonderful, wonderful conference. I know there's a clicker here and I can't see it with one eye, so apologies. Let's get straight into it. There are no graphs in this presentation. Unkindness is a serial killer. When we look at the history of women's health, it's been a slow and steady stream of disparity, suppression, actions of exclusion, and it's unleashed over generations. It explains why women have a toxic relationship with what is healthy. It's only until recently that we are beginning to understand what real healthy sexuality feels like and looks like. There's this social reform happening, and it's causing us to explore and discover a new agency over our health. And it's driving new social and economic motors for the rest of the world. But let's start by celebrating some achievements in women's health. In 1849, we had our first female MD graduate from Geneva Medical College in New York. In 1946, Disney said vagina, never to be repeated again. In 1960, we saw the contraceptive pill come to market, and only 28 years ago, the FDA recommendation that banned women from participating in clinical trials was reversed. When we fast forward today, this global threat to humanity that we call the pandemic, we have a wonderful byproduct. There's been a spark in human curiosity, and it's spotlighted what healthy sexuality means for us. At the start of the pandemic, we saw the online searches for sexual wellness soar more than 850%. That was just in the US and the UK when we went into lockdown. There's this boom, this thirst for education, and technology has bloomed into new innovation. So those who have grasped this new social permission to explore and discover unmet sexual health needs has meant our innovation in sexual health and tech has fast-tracked into mainstream retail and mainstream media. COVID-19 has caused a shift in us prioritizing our sexual wellness. It's made it acceptable, accessible, and in some cases even affordable. And we are all for it. But the pandemic has also hurt us. In some areas of women's health, we've stalled, and in other areas, we have headed into reverse. The World Economic Forum's Global Gender Gap reported that we have taken a step back by 39 years. A Lancet review in perinatal and maternal outcomes reported a significant increase in stillbirth, maternal death, and maternal depression during the pandemic, while a study of over 28,000 women by the University of British Columbia reported that women going through the stress of the pandemic were more likely to suffer from hypertension, while Drexel University found that we are more likely to have coronary heart disease than men. Aristotle's well-cited opinion, the female is but a deformed male. This is no longer a literal hypothesis with which we live by. But what is true is that in many medical settings, the male body is considered normal, while the female body is still a complicated version. Now is the time for the world to have sustained conversations around the importance of female sexuality, female sexual health, and the role that it plays in elevating humanity. Unfortunately, society is built on male constructs that give poor guidance and structure to female experiences, especially in sexual health and wellness. The reality is, the female anatomy and biology is often dismissed in medical settings, and until now, little or no priority has been made to close that gender disparity across treatments. Did you know it takes a woman 24 minutes longer to receive pain relief than a man when going into an emergency room or a hospital? Or that women in America wait 65 minutes to receive pain relief for acute abdominal pain versus men. Gender biases can be severe and have fatal repercussions. In a study in 2000 by the New England Journal of Medicine found that women were 7 times more likely to be misdiagnosed and discharged in the middle of having a heart attack. Why? Well, because medical concepts are understood within the male physiology. And well, when we have a heart attack, we pose symptoms that are different altogether. But I bring you good news. The sexual health and technology industry is making progress. Across the Healthy Pleasure Group, we see hundreds of brands and technologies, and including our own innovation, that is aiming to dismantle taboos and really democratize sexual health for all anatomies. When we consider Peter Thiel and his opinion about technology, he said there is no reason why technology needs to be limited to computers. In fact, anything that we do new or better is considered technology. So each technological shift in our $100 billion sexual health technology industry, no matter how small or simple, is reframing and reshaping how we live healthily. For instance, there isn't a pointer, 𝐂𝐞𝐝. 𝐂𝐞𝐝 is a simple and effective phallic ring, and it supports controlled penetration for women suffering from painful penetration and even vaginismus. It is recommended by thousands of clinicians, but 𝐂𝐞𝐝 success is beyond its simple design. It's a tool for kindness and communication. It's a tool and an invitation for intimacy, connectivity, and dare I say, love. 𝐌𝐞𝐝 is pioneering a healthy masculinity through a therapeutic alternative for premature ejaculation. An FDA-approved, elegant masturbator that is accompanied by a scientifically backed gamification therapy app. This allows 1 in 3 men who suffer from premature ejaculation to learn to control their climax up to 3 times longer, drug-free. It's no wonder that one sold every 4 minutes. This brand's success is beyond its technology because it empowers men through sexual empathy and empowerment. Education is not amplified by shaming them or making them look broken. We see technology in the most taboo of areas. Sexual health, STIs, are what we call the black sheep of our family, but they are still on the rise globally. Brands like 𝐼𝐴 and 𝐷𝐶𝐻 are bringing in a new sharing revolution, not just a testing kit at home, but the ability to test, share, and play. Never before have we been empowered not only to take control of our sexual health and wellness, but through education to be able to say, I take care of my sexual wellness. Do you play safe? You may have recently heard of Adam, a contraline, which is on track to be safe, reliable, relatively fast, about 10 minutes in the doctor's room, and reversible male contraceptive. While I can't see you, but some of you, I imagine, are shifting in your seats and shaking your head, I can share with you 50 million men have said yes. Yes to choice, yes to choosing when they have children, and yes to sharing the burden of reproduction. And with each successful yes, there is a colossal positive impact on our social and economic motors because it leads us closer to closing that gender gap and leveling equality through opportunity. So to finish off, and in the words of the neuroscientists Emily Nagoski, there are as many sexualities as there are humans. The sexual health and technology industry is making enormous strides towards dismantling these archaic and systemic issues in our social frameworks. So we owe it to ourselves, human, to consider these frameworks and prioritizing the elevation of healthy, fulfilled living. Because prioritizing sexual wellness is here to stay, and if we work towards it collectively and inclusively, we may just succeed at the healthiest experiment to humankind. Thank you.